As we grow older, many of us find ourselves taking more and more medications. Some are for the heart, some for diabetes, some for pain, and others to help us sleep. It feels like every doctor's visit adds another pill to the list. And while these medicines can truly save lives and ease suffering, they can also become dangerous if used the wrong way. In fact, some of the most common medications that older adults take every day can lead to serious problems, even death, if not managed carefully. Today, I want to talk with you about 5 categories of medicines that are both very common and very risky for seniors when taken incorrectly. But don't worry, this is not meant to scare you. It's meant to empower you. By the end of this conversation, you'll know what to look out for, what questions to ask your doctor, and how you and your loved ones can stay safe while still getting the benefits from the medicines you need. Before we dive in, I want to remind you, if you find this podcast helpful, please take a second to hit the like button, share it with your friends, and subscribe to the channel. That way you won't miss any of the future episodes designed to help older adults live healthier, longer, and safer lives. Let's begin with one of the most powerful but also dangerous groups of medicines, blood thinners, also called anticoagulants. These drugs include warfarin and newer ones like rivaroxaban and apixaban. Doctors often prescribe them to prevent strokes, blood clots in the legs, or complications after heart surgery. For many people, these drugs are lifesavers. But here's the hidden danger. Blood thinners make it harder for your body to clot. That means a simple bump on the head, a small stomach ulcer, or even brushing your teeth too hard can sometimes lead to serious bleeding. In seniors, bleeding can be much harder to control. The most frightening risks are internal bleeding in the stomach or brain. Imagine someone suddenly passing out or becoming weak on one side of the body. That could be a brain bleed made worse by a blood thinner. Or think of black stools or vomiting blood, signs of a hidden stomach bleed. These situations are emergencies. So how do you stay safe? First, never stop or change your blood thinner on your own. Stopping suddenly can cause a stroke. Always check with your doctor if you notice unusual bruises, bleeding gums, or dark stools. And be careful with over-the-counter painkillers like ibuprofen or aspirin. They can interact with blood thinners and make bleeding even more likely. Now let's talk about another very common category, insulin and other diabetes medicines. Diabetes is so common in older adults that many people see insulin and pills like glibenclamide as routine. But here's the truth. These medications can cause dangerously low blood sugar, called hypoglycemia, if used incorrectly. Unlike high blood sugar, which builds slowly, low blood sugar can strike suddenly. 1 minute you're fine, and the next you're sweating, shaky, confused, or even unconscious. Why is this so dangerous in older adults? Because seniors may not feel the early warning signs as clearly. Their bodies don't always send the usual signals. That means hypoglycemia can sneak up without warning and lead to falls, seizures, or even coma. To prevent this, always take insulin or pills as prescribed and never skip meals. Keep a small snack handy like a piece of fruit or some crackers. And let your loved ones know the signs of low blood sugar, so they can help if you become confused. If you ever feel shaky or lightheaded, don't wait. Eat something with sugar right away. Better safe than sorry. The third group is one that many people don't even think twice about, strong painkillers or opioids. Names like morphine, oxycodone, fentanyl, and tramadol may sound familiar. These drugs are powerful tools for managing severe pain, especially after surgery or when living with conditions like cancer. But in older adults, opioids can be extremely risky. The biggest danger is that they slow down breathing. If you take too much, or if you mix them with alcohol or sleep medicines, your breathing can become dangerously shallow. That can lead to brain damage or even death. There are other problems too. Opioids can cause confusion, drowsiness, and constipation, which increase the risk of falls, dehydration, and hospital visits. And the scary part is that sometimes the early warning signs, like being unusually sleepy, are brushed off as just old age. But in reality, it could be an overdose creeping in. If you or someone you love takes opioids, safety must come first. Take them exactly as prescribed, never share them, and avoid mixing them with other sedatives unless your doctor approves. If you notice someone is hard to wake up or is breathing very slowly, call emergency services right away. Closely related are sleeping pills and anxiety medications, especially benzodiazepines like diazepam, lorazepam, alprazolam, and the so-called Z drugs like zolpidem. These medicines may help you relax or fall asleep, but they carry big risks for seniors. They can make you confused, sleepy during the day, and unsteady on your feet. That means more falls, more broken hips, and more time in the hospital. Studies show that older adults are far more sensitive to these drugs, and the effects can last much longer in the body. The real danger comes when benzodiazepines are combined with opioids. That combination can shut down breathing in a very short time. Unfortunately, it's not uncommon for seniors to be prescribed both, especially if they struggle with pain and anxiety. So what's the safer path? If you take these medicines, talk to your doctor about whether they are still necessary. Sometimes safer alternatives exist, like cognitive behavioral therapy for sleep, relaxation techniques, or milder medications. And never double your dose just because you're having a rough night. That's how accidents happen. Finally, let's look at a group of drugs that many people buy right off the shelf at the pharmacy. NSAIDs, or non-steroidal anti-inflammatory drugs. This includes ibuprofen, naproxen, and even aspirin when used for pain. We all know these medications for headaches, arthritis, or back pain. But in older adults, NSAIDs can quietly cause ulcers, stomach bleeding, kidney damage, and even heart problems. When combined with blood thinners, the risk of dangerous bleeding skyrockets. Have you ever noticed stomach pain or black stools after taking pain pills? That's a red flag. Have you been told your kidneys are not working as well as they used to? NSAIDs can make that worse. Even high blood pressure can get harder to control if you take them regularly. So what should you do? First, avoid long-term use without medical supervision. If you have heart disease, kidney disease, or a history of stomach ulcers, talk with your doctor before taking them at all. And don't assume that over-the-counter means safe. For seniors, even common painkillers can be risky. So we've talked about 5 groups of medicines that deserve special attention. Blood thinners. Diabetes medications like insulin and sulfonylureas. Opioid painkillers. Sleeping pills and anxiety drugs. Over-the-counter NSAIDs. But here's the bigger picture. Many seniors are on several of these at the same time. This is called polypharmacy, taking multiple medications. When you combine drugs, the risks multiply. A blood thinner plus an NSAID equals a higher chance of bleeding. An opioid plus a sleeping pill equals a higher chance of slowed breathing. That's why medication reviews are so important. At least once or twice a year, bring all your medicines, including vitamins and over-the-counter pills, to your doctor or pharmacist. Ask them to check for dangerous interactions. Sometimes, a medicine that was helpful 5 years ago is no longer the best choice today. It may be time to lower the dose, change it, or even stop it. And don't forget, communication saves lives. If you feel new symptoms, confusion, dizziness, stomach pain, unusual bruising, don't brush them off as just getting older. They could be side effects or warning signs that your medicines are harming you. Report them right away. Now, I know this is a lot of information. It might even feel overwhelming. But here's the good news. You are not powerless. By staying informed, asking good questions, and paying attention to your body, you can avoid the worst risks while still getting the benefits of modern medicine. Here are some practical steps you can take starting today. Make a medication list. Write down every medicine you take, the dose, and the time of day. Keep it in your wallet or on your phone. Share it with every doctor you see. Watch for red flags. Things like unusual bruises, black stools, sudden confusion, or extreme drowsiness should never be ignored. Ask before adding new drugs. Even something as simple as a cold medicine or herbal supplement can interact badly with your prescriptions. Schedule a medication review. Ask your doctor or pharmacist to go over all your medicines at least once a year. Educate your family and caregivers. Make sure the people around you know what to watch for and how to help in an emergency. I want to leave you with this thought. Medicine is powerful, but knowledge is even more powerful. The same pill that saves one life could endanger another if not used properly. Especially in older age where the body processes drugs differently, being cautious and proactive is essential. If you're listening today and thinking, wow, I need to check my pills, then you're already taking the first step towards safety. Don't keep this knowledge to yourself. Share it with your friends, your spouse, your siblings. The more people know, the more lives we can protect. And before we wrap up, let me ask you a favor. If this podcast was helpful, please give it a like, share it with someone you care about, and subscribe to this channel. That way we can continue bringing you simple, practical advice to help you live your golden years with more safety, more strength, and more peace of mind. Thank you so much for spending this time with me today. Take care of yourself, keep learning, and remember, It's never too late to take control of your health.